Hi, everyone. We're back with Dr. Gelman to answer your questions regarding GLP1s. It's a really hot topic a lot of our patients have questions about. So, those medications, for instance, Ozempic, Manjaro, tirzepatide, semaglutide, are very popular, but they can be sometimes, not indicated, especially if you're doing IVF. So, we want to kind of hone in on some questions that you guys have asked, and we'll get to the bottom of some of them. So the first one is, do they improve egg quality? So what do you think, Dr. Goodwin?
Well, the data is not really in terms of that, but you would think that it would definitely help improve things because there's no question it improves inflammation. These
Hmm.
drugs really have a tremendous benefit in terms of reducing some of the cytokines and things that we measure as indications of inflammation. And there's no question that those drugs, with the accompanying weight loss that occurs, reduce inflammation. So you would think that egg quality could be as best as it could be based on the patient's age.
Yeah.
It's not going to make a woman, unfortunately, who's 42 years old, improve their egg quality to a 30-year-old. That's
Hmm.
not going to happen. But it may improve the environment and things around that could be exposing the eggs to along their journey
Hmm.
to inflammation and making things a lot worse. So
Yeah.
there's no question that they help that, I think. But the formal studies I have not seen in terms of that.
Okay. And I guess, with insulin resistance, we look at that causing, inflammation, and reducing inflammation is very important. So when we look at what these medications can do, how important is that, as far as if someone is overweight, or they perhaps have just maybe like 20 pounds overweight, or they have a little bit of like high cholesterol, the glucose is a little elevated. How important would that be for someone to start GLPs maybe a couple months prior to
Yeah, well,
starting?
that would be the indication. So
Mhm.
I think that that's the appropriate thing to do for the primary care doctor to help us out and do those kinds of things to reduce that, because that's all indicators of some type of inflammatory process going on, especially insulin resistance, obviously. So I think if we can reduce all that ahead of time, we're going to improve our outcomes as best as we can possibly improve them.
Yes, and I know you guys stress nutrition is very important. You have nutritionists on staff, and we have also our nurse practitioner here who works with our patients on weight loss, nutrition, a combination approach of herbal medicine, a little bit of medication